Neurological examination of the upper limbs.
To see the upper limb, you have to fully expose the body. Even if they are wearing the barrier, you have to remove. That is very, very important for the student was fail. Because he didn't observe the scar in the back. This case was fail. Right? So then you have that. Look for this the scars. Right? So in the shoulder, the girdle, and then the back of the usually they perform a surgery here. Right? The cervical and the symptoms are the signs are in the both the hand. So the surgery has done here. When you come to correlate these signs with the etiology, if you can't correlate in the exam, then your case is very. Right? So that is why I'm not exposing this thing to the personal thing. Right? We practice makes perfect. Right? Then how do they examine? Same principle: inspection, palpation, tone of the muscle, and the power of the muscle, reflexes, and the coordination. Right? So those are the four things. So then how to inspect the hand is one of the important things. You have to start the hand like this. Or if there is a pillow, the best thing is in the pillow. Usually there is a pillow. When there is any cases in the hospital setup, right? So we are giving a pillow and then you take the pillow and keep over the thigh and ask to keep the hands like this and then you examine. Right? So the first thing is that the inspection. What are the things you inspect? Again, the atrophy and the hypertrophy. Atrophy and the hypertrophy. This is what group? This is a thinner. This is hypothenar. Thinner and the hypothenar are the very important thing. You have to look for the thinner muscle wasting or the hypothenar. Right, so there is a thing called, you know, that the median nerve will be compressed here, and then we call as a carpal tunnel syndrome. Right, the carpal tunnel, you know that the carpal bones and the vacant tunnel, and we have the flexor retinoculum like this, right, and when the nerve is going through this, and when there is a compression, then the median nerve will be the first thing, and there will be a fight for the thinner muscle wasting. So wasting of the thing are the very important thing, right? At the same time, you have to ask the first thing whether you have any pain in your shoulder, elbow, or the wrist. That's one of the important things before examination. If you turn the patient, right? Patient, wow, shouting with the pain, your case will be pain. We thought that you are inhuman doctor, right? And then not considering the patient, the patient, you are not considering the patient, the pain, and you are inhuman and not caring. You ask that and then turn the patient to the other side, and then you what is the important thing and ask the patient to, right? And abduct the fingers and see whether there is a dorsal guttering. So this is supplied by the which muscle? Lumbricals. Right? So when there is a lumbrical wasting, you can see the dorsal guttering. Lumbricals are supplied by which nerve? There are lumbrical? Ulnar, right? Ulnar. So then if you detect the dorsal guttering, so you have to say that okay, this patient is having a dorsal guttering, and then okay, so that is inspection. And if there are some scars, say suppose that the patient had a cut injury here, right? Patient having the wrist drop, then you have to examine. Okay, so then when there are some the scars, right? Scars at the wrist, elbow. Right? So then if there is elbow and patient we gave the scan for the wrist drop, and then you have to say that okay, this patient is having right side wrist drop. The most probably I noticed that there is a scar at the elbow, right? So it's a traumatic radial nerve. That is how, if you say that completely, you pass and give a full mark. You the wrist drop, you will decide whether you just pass or sometimes you do not pass. So the inspection of the elbow is one of the important things, especially, and the patient is the leprosy. You know that there is a condition for the leprosy, and then whether the scars, and then whether ulcers. You know that there is the disease called syringomyelia. Right? The syringomyelia, the myelia means the spinal cord. Right? The upper part of the central canal will be expand and it become like a syringe. Right? If it is happened in the center of the spinal cord, we call it syringomyelia. If it is happened in the bulb area, we call it syringobulbia. The syringomyelia, the classical presentation is that their pain and temperature will be lost because the anterior, the spinothalamic tract decussate, It just in front of the central canal. When the central canal is enlarged gradually and gradually, is the sensory relaxation will be damaged and the patient will have a pain and temperature loss in the bilateral arm. Right? So how the pain and loss their presentation, they will lose their pain and when they put their hand into the when they are the firing something, cigarette, the smoking or the lighter burn or the when the normal people, lay people when they are the cooking or the firewood and they will get some burn and the burn mark and then then sometimes the cut injuries that indicate this patient is having some chronic pain syndrome, neuropathic pain. So that is why the inspection will get a lot of clue. Right? So the upper limb examination, the hand are the most predominant, the most important clue. You have to detect clue from here to up to here, up to diagnosis. The end of the examination, you have to come to diagnosis. This is this patient diagnosis. Right? That is the beauty of the neurological examination. Okay, you look for the scars, you look for the hypertrophic changes and then the atrophy, hypertrophy, and then the neuropathic ulcers, and sometimes when there is a ischemia. So what is the ischemia? Sometimes when they have a peripheral vascular disease and there are loss of the hairs, shiny skin, especially in the diabetic patient, right? And the scars, and then don't forget to look at the, you have to come back from the behind and the patient, see whether there are some scapular area and then the cervical area, right? You have to say that the scar. Then start with the muscle bulk. Try to how to take the muscle bulk. You take your hand like this and feel over the biceps and the tricep muscle and say that okay the muscle bulk is okay, right? And then no fasciculation. You just tap and see only one tap. Don't put too much of tapping like this, like a drum beating, right? And then you just tap and see. Then you know that we know that this student is looking for the fasciculation. That you have to show, and then the fasciculation, and then the bulk of the muscle, and then the tone. How to tell the tone of the muscle? Just round and the round and round in the circular manner. Its tone is normal, and then compare with the other side, and then hold the at the elbow, and then you bend up and down. Okay, so this is the normal tone, and then you just bend, and then you do this pronator and the supinator. Supinator and the pronator assessment. Again, it is the normal. So it's the normal tone, right? And then we come to the power. How to assess the power? Like this. So then the push to up, right? The push me down. So then what are the muscle we are checking? Push me up. Okay. What is that? Huh? Yes. You are taking the deltoid muscles and then push me down. What's the thing? And what's the adduction and adduction? Muscle. Huh? Okay. Okay. Now then we are that. Okay. Now don't let the pulling your arm. Right. So then right. Push me away. Okay. And then. So pull it, push me, push, right, and pull it, push, right. Okay, now the elbow muscles are opening. Now then you are taking the external and internal rotation. So I am trying to rotate it towards the medial, and you have to the push me away. So that is medial rotation and lateral rotation. Medial and lateral, and then you have to examine the hand also. Right, so then. Right, so in the closing, right, push me up, that is radial, and push me down, right, push me down, right, okay. And the space you is don't let me close it, right. So this again, we are checking for the ulna, so basically is you have to keep over the pillow and the exam, right. So this is the how to examine the ulna, right, okay. And then you have to take a piece of paper. Anybody have a piece of paper? And then this is again the one way of checking the ulna. Right. So what you have to do is you have to hold with your finger, right? The same finger. The patient also should hold, right? So you are the index and the middle, and the my index and the middle. Not like this. So we apply with the thumb and the, I am putting the more pressure and we put the less pressure. So same thing, the comparison. Press normal and release, and then it's normal, and then it's normal. So we check the ulna and then clear. So this everything you have to check, right? And then that is ulnar nerve. And then you have to check all the medial nerve function. So you have to check the opponent, right? Alright. So make it done. Don't let me. So then, okay. So all the we compare with the other side, right? So they are from the opposition. Position. And then what we earlier check was this thing, and then you have to lift this up and push me up. And then push me up, push me down. That is a different part of the radial nerve. So let's say that the what part and the which branch of the radial nerve we are checking. And the radial, ulnar, the medial, both nerves you can check by using the hand, right? Hand examination. And then we come to the reflexes. Reflexes we are checking the three reflexes, right? So then first relax the arm, like how to relax the arm. And you have to ask the patient to keep his or her hand over your hand. Now you have to relax. Just feel this is a tricep. Just tap one to look for the contraction of the tricep. At the same time, you just tap the bicep. Tap the bicep. You have to keep the thumb over the elbow and just tap over your thumb, right? And then here you compare, right? You keep over the thumb over the elbow weight and just one tap, but look for the contraction of the bicep, right? So bicep, this is bicep, and this is supinator, right? This is supinator here, just tap, it's working, and this is supinator here, right? Supinator here, and then you have to always compare this side. So ideally speaking, okay, bicep here, bicep here, bicep, bicep. Always compare. The supinator here, supinator here, right? So what are the root values? Bicep, C5, C6. And the supinator, C6, 7. And the bicep also C6, 7. So that root value also you should know. And then the coordination, what you have to do is you have to demonstrate your arm, touch my finger, and to touch your nose. So that is the coordination. We did the use of the hand. So that is coordination. That is we do with the cerebellar veins also. That's hand coordination. And then so that is end of the mode examination. Normally, sensory is same, right? Sensory is same. And you have to check this thing and look for the up and down and see the joint position sensation. And then you keep the tuning for this body prominence, right? And see the vibration. And then you do the pinprick sensation from here to there, from there with the toothpick, and then the line touch with the cotton roll. Right? Cotton roll, and depending on the finding, you have how to the sensation on that. Whether the one side is or the both sides, symmetry or asymmetry. One of the most important is the neuron. Symmetry or the asymmetry, and if the asymmetry is there, what kind? Trophy, the hypertrophy or the weakness, right? And then make sure that the scars not to miss the your black.
That brings us to the end of this video. Thank you for watching.